In a story recently aired on CNN, Charlotte Figi exemplifies the significant benefits of medical marijuana in controlling and minimizing the effects of seizures. At 3 months old, Charlotte Figi began experiencing seizures lasting up to 4 hours at a time. For years, her condition continued to worsen despite hospitalization and medications. Charlotte was diagnosed with Dravet syndrome, a severe type of epilepsy that is resistant to most medications. The Figis tried every treatment the doctor suggested, including medication and changing her diet. This caused even further side effects such as bone loss, immune deficiencies, and cognitive decline. At her worst, Charlotte was experiencing 300 mild seizures a week, had lost the ability to walk, talk, and eat, and even had her heart stop numerous times to where her mother had to perform CPR till the ambulances arrived. In a last-ditch effort and after tons of research, the Figis, who were 100% against the use of medical marijuana before their daughter's condition, decided to try cannabis after hearing its positive effects for a boy with Dravet syndrome in California. After obtaining the proper doctor's authorizations, extracting the cannabis oil, and administering the dosage, Charlotte's seizures stopped. When she didn't have those 3-4 seizures that first hour, that was the first sign, Page recalled. And I thought, well, let's go another hour. This has to be a fluke. The seizures stopped for another hour and the following 7 days. Page said she couldn't believe it. Now 6 years old, Charlotte only experiences 2 to 3 seizures per month and is beginning to gain back some of her brain functions like talking, walking, and eating. I didn't hear her laugh for 6 months, Page said. I didn't hear her voice at all. I just heard her crying. I can't imagine that I would be watching her making these gains that she is making, doing the things that she is doing, and I don't take this for granted. Every day is a blessing. Matt added, I wanted to scream it from the rooftops. I wanted other people and other parents to know that this is a viable option. Cannabis has been used throughout history to treat and help lessen the side effects of numerous different diseases in civilization around the world, with the most known recorded use in 2737 BC. Recent research and case studies have shown promising benefits of its use of marijuana to help treat symptoms such as pain, nausea, and even seizures in a variety of patients. In these type of treatments, patients can use multiple portions of the marijuana plant to find out the method of use that is most effective for their situation. Medical marijuana exists in many forms, such as cannabis oil, topical ointments, pills, sprays, edibles, and the most well-known form is which people smoke. Each method has its pros and cons, which allows the patient to choose which one works most effectively to treat their symptoms. There is much controversy surrounding the methods, usage, and research that has been conducted to determine the effects of medical marijuana in treating numerous different diseases and their side effects. According to this research and a number of case studies, marijuana or cannabis has the ability to not only ease the side effects of numerous diseases, but in many cases eliminate them altogether. Much controversy surrounds the use of cannabis to treat disease symptoms. Despite the research and data that supports its positive effects on patients' quality of life, marijuana, whether for medication or recreational use, is still viewed by the majority of the country as an illegal drug. Although criminalized in the United States in 1937 against the advice of the American Medical Association, cannabis was not removed from the United States pharmacopoeia until 1942. Given the Schedule I status of this drug, patients have continued to obtain cannabis for medical purposes throughout statewide programs and cannabis dispensaries, which are facilities or locations where medical cannabis is made available to qualified patients. Recently, studies have begun to legalize marijuana for medical use, but this topic will continue to be an area of discussion in future legislation. On October 19, 2009, the Justice Department's memorandum begins by stating that the department is committed to the enforcement of the Controlled Substance Act in all states, and that it is cognizant that Congress has determined that marijuana is a dangerous drug. But because the department is also committed to making efficient and rational use of its limited investigation and prosecutorial resources, the department should neither investigate nor prosecute individuals whose actions are in clear and unambiguous compliance with state law. This means that patients who use cannabis to help alleviate their symptoms can do so without fear that they will be prosecuted for their illegal actions, so as long as they are following state law. Deciding whether or not prescribing medical marijuana to a patient is in their best interest is an area of ethical concern for professionals in the field of medicine. Doctors must use research to weigh the benefits and risks for each patient to determine if cannabis is the best option. In the article, Medical Use of Marijuana, Dr. Bostwick states, within established doctor-patient relationship, I endorse thoughtful prescriptions of medical marijuana for patients. A largely anecdotal but growing literature supports its efficacy, particularly for pain or nausea that is unresponsive to mainstream treatment. The Fiji's case study discussed previous supports Dr. Bostwick's claim that there are limitations to current technology and medicine that make conditions impossible to treat with traditional medical practices. These situations, like Charlotte's, require thinking beyond what is common practice and experiment with new ways to treat patients. Cannabis is one of these treatments. It may not be widely accepted, but in the Fiji's case, they tried everything else with no positive results, and her doctors were at loss for what to do next. They did their research, but got the support of their doctors and did the best thing that they could have for their daughter. It turns out the treatment that proved most effective was not only Charlotte, but for numerous people is considered illegal in this country. The benefits of medical marijuana use can range anywhere from treating pain, nausea, and vomiting to reducing seizures and treating neuropathy. One of the primary uses for cannabis is in the treatment of chronic or severe pain in patients with cancer, multiple sclerosis, HIV, etc. Overall, these studies show statistically significant improvement in various types of pain when medical cannabis is used. Trials indicate that smoked cannabis or cannabis extract are effective for several different types of pain, primarily neuropathic pain. In the study conducted and discussed by the authors of Pharmacologic and Clinical Effects of Medical Cannabis, patients with chronic pain participated in a study in which they were used to smoke marijuana containing varying concentrations of THC, including a placebo. The results indicated that those who were given the higher concentrations of THC experienced significant pain reduction compared to those on a placebo or lower concentrations. The side effects were also discussed in this article and were classified as mild to moderate, including headache, dry mouth, dizziness, conjunctival, dry eyes, hypotension, and difficulty with concentration or memory. Like all medical treatments, there are side effects of using cannabis to treat pain or other symptoms, but the benefits compared to the minimal side effects could have a significant impact on a patient's quality of life. Marijuana has also been shown to be effective in helping to reduce the number of severity of seizures in those with epilepsy, providing them the opportunity to have a better quality of life. In the case study by CNN of Lavi Parush, his parents discussed their son's condition and the benefits of using cannabis oil to treat his severe seizure disorder. 2 years old, Lavi Parush was born with cerebral palsy and severe epilepsy. He was experiencing dozen seizures per day, causing brain damage and significantly impacting his quality of life. After trying numerous ineffective medications and suffering from the extreme side effects of these prescription drugs, Lavi's parents decided to try CBD or cannabis oil to help reduce the severity of his seizures. Lavi has been taking a few drops of oil daily with his food for about a year. His parents stated that the effects of medical marijuana were noticed immediately, and the improvement in Lavi's quality of life has significantly impacted the entire family. His father stated, "We saw a difference immediately, and then after a few weeks, we didn't see any seizures at all. The CBD has such an impact on Lavi's life to the point that he has not had a single seizure in months. Now Lavi and his family can enjoy their lives without anxiety and the worry about revolving their lives around the seizures." Like the Fijis, Lavi's parents were at their wits' end and chose a cannabis as a last-ditch resort to help their children find some form of normalcy in their lives without having to constantly worry about seizures and medication. Parents like Lavi and Charlotte's have tried the doctor recommendation treatments and prescriptions with little to no significant improvement and extreme negative side effects. Desperate to find a way to help their children, they have chosen to try cannabis oils or other forms of medical marijuana to find that it significantly helped improve their children's as well as their own quality of life. While medical marijuana has proven to benefit some patients, its use in everyday medicines is still a topic of discussion across many professional fields, including medicine as well as government. For parents like Charlotte and Lavi's, cannabis was an answer to their prayers, giving their son an opportunity to have a higher quality of life without seizures. The benefits of medical marijuana can assist many people in living a better life free of pain, nausea, and even seizures. However, just like any newly introduced medical treatment or medication, there is research that has to be done, ethical concerns to address, and side effects to consider. Cannabis was used for a routine medicine for millennia before criminalized in the United States in the early 1900s. There's much controversy over its emerging uses today, but the fact remains that in these two cases and many more like them around the country, medical marijuana was the last resort that proved most effective for their children and their families.